Vertigo, a sensation of feeling off balance or experiencing a sense of dizziness or spinning, often arises from issues with the inner ear or brain. Signs and symptoms of vertigo can vary significantly, and some might not be immediately apparent. Here are 5 hidden or less obvious signs of a potential vertigo attack. 1. Nausea or vomiting. These are often associated with vertigo because the condition involves a disruption in the way the brain perceives movement and spatial orientation. This confusion can result in a sensation akin to motion sickness, with accompanying nausea and, in more severe cases, vomiting. The sensation of movement, either of your own body moving or of the environment around you moving, that comes with vertigo can be extremely disorienting. Your brain receives signals from your inner ears, eyes, and other parts of your body to understand your body's position in space. When these signals are disrupted or misinterpreted, as with vertigo, it can result in a sense of spinning or tilting. This disorientation can be comparable to the seasickness some people experience on a boat, where the constant, unfamiliar motion can lead to feelings of nausea or even cause one to vomit. In cases of severe or prolonged vertigo, the nausea can become so severe that it leads to vomiting. This can be particularly problematic because repeated vomiting can lead to dehydration and other health concerns. Moreover, the physical act of vomiting can, in itself, exacerbate the sensation of vertigo, leading to a vicious cycle. If nausea and vomiting are severe, frequent, or accompanied by other serious symptoms like a severe headache, fainting, slurred speech, or sudden hearing loss, it is crucial to seek immediate medical attention. These could be signs of more serious conditions, like Meniere's disease or stroke. Also, note that there are anti-nausea, antiemetic, and anti-vertigo medications that can help manage these symptoms, and some people also find relief through physical therapy techniques or maneuvers designed to reposition particles in the inner ear. As always, the exact treatment will depend on the underlying cause of vertigo, so medical consultation is necessary. Number 2. Difficulty focusing or concentrating. Vertigo can sometimes manifest as a subtle difficulty with focus and concentration. This is related to the disorientation and sense of imbalance that the condition can produce. Our ability to focus and concentrate is dependent on a complex interplay of cognitive processes and sensory inputs. When there is a disruption to these inputs, such as the disorientation and imbalance experienced during a vertigo episode, our ability to concentrate and focus can be affected. Vertigo is associated with an incorrect sense of spatial orientation. This means that even if you're sitting still, your brain might interpret signals as if you're moving or spinning. This constant sensation of movement can be extremely distracting, making it hard to focus on tasks at hand. Furthermore, the dizziness and nausea that often accompany vertigo can compound these difficulties. If you're feeling dizzy or sick, it's naturally much harder to maintain focus and concentration. It might be hard to read, watch TV, or even carry on a conversation. You may find your mind wandering or have trouble following complex instructions. This inability to concentrate can also extend to cognitive tasks. People with vertigo might have trouble remembering things, making decisions, or thinking clearly. The constant sense of motion or spinning can make it hard to process information as quickly or as accurately as usual. It's important to note that these symptoms can also be signs of other conditions, including anxiety, depression, and certain neurological conditions. If you're experiencing persistent difficulties with focus and concentration, it's a good idea to seek medical advice. In the case of vertigo, various treatments are available, ranging from physical therapy maneuvers to medications, to help manage the symptoms and potentially resolve the condition. Number 3. Changes in hearing. Vertigo often occurs due to issues within the inner ear, which is not only essential for maintaining balance but also for hearing. Therefore, changes in hearing can sometimes be a sign of an impending vertigo attack. One type of vertigo, called Meniere's disease, is specifically associated with hearing changes. These changes can include hearing loss, a feeling of fullness or pressure in the ear, or tinnitus, which is characterized by a ringing, buzzing, or hissing sound in the ears. These symptoms often occur before a vertigo attack in the case of Meniere's disease, acting as a warning sign. The hearing loss associated with Meniere's disease is usually in one ear and can fluctuate, becoming worse during an attack of vertigo. Over time, some people with Meniere's disease may experience more permanent hearing loss. Benign paroxysmal positional vertigo, BPPV, another common cause of vertigo, is less likely to cause hearing problems. However, Labyrinthitis and vestibular neuritis, both conditions that cause inflammation in the inner ear, can lead to vertigo and hearing changes. The hearing changes associated with vertigo can range from mild to severe. If you notice any changes in your hearing, such as difficulty hearing, tinnitus, or a feeling of fullness in the ear, especially if it's associated with dizziness or balance problems, it's important to seek medical attention. These symptoms could indicate a problem with the inner ear that requires treatment. 4. Nystagmus. This is a condition that causes the eyes to make repetitive, uncontrolled movements. These movements often result in reduced vision and depth perception and can affect balance and coordination. They can occur side to side, up and down, or in a circular motion. In the context of vertigo, nystagmus can be a significant sign of an issue with the inner ear or brain. It's often a response to a malfunction in the body's vestibular system, the part of the inner ear that sends messages to the brain about the body's motion and position. The uncontrolled eye movements are generally the brain's response to mixed signals it's receiving. For example, if the brain gets incorrect information that the body is spinning around, one of the possible misinterpretations during a vertigo attack, it might trigger eye movements to compensate for this perceived motion. Nystagmus can be challenging for the individual to notice because the feeling of the world moving, vertigo, can overshadow the sensation of the eyes moving rapidly. However, a healthcare professional or even a friend or family member might observe these rapid eye movements during a vertigo attack. Given the potential seriousness of conditions that can cause nystagmus and vertigo, it's crucial to seek medical attention if you or others notice these eye movements. Diagnosis usually involves a thorough examination by a healthcare professional, who may refer you to an eye specialist, ophthalmologist, or a specialist in ear, nose, and throat disorders, otolaryngologist. Depending on the cause, treatment may involve medication, physical therapy, or in some cases, surgery. For instance, if nystagmus and vertigo are due to an inner ear condition like Meniere's disease or vestibular neuritis, medications to control dizziness, nausea, and inflammation may be prescribed. In other cases, specific maneuvers to reposition particles in the inner ear might be recommended. 5. Unsteady gait. This refers to a pattern of walking that is incoordinated or appears clumsy. You might stumble frequently, have difficulty maintaining a straight line when walking, or seem to be off balance. In the context of vertigo, an unsteady gait can occur because the inner ear plays a crucial role in maintaining balance. The vestibular system in your inner ear sends signals to your brain about your body's position and movement. If there's a problem with these signals, such as with vertigo, it can disrupt your balance and coordination and make your gait unsteady. This unsteady gait can be more pronounced during a vertigo attack, but it can also occur subtly before an attack. You might not even realize that your balance is off, but you may notice that you're bumping into things more often, having trouble navigating turns, or needing to hold onto things for support while walking. An unsteady gait can also increase your risk of falls, which can lead to injuries. So it's important to take precautions to avoid falls if you have vertigo, such as using a cane or walker, making your home safer, for instance, by removing tripping hazards, and being extra careful when walking in low light conditions. If you notice an unsteady gait in yourself or others, especially if it's accompanied by other symptoms like dizziness, nausea, or changes in hearing, it's a good idea to seek medical attention. The unsteadiness could be a sign of vertigo or other medical conditions like neurological disorders. Treatment for vertigo-related unsteady gait usually involves addressing the underlying cause of vertigo. This could include medications to reduce symptoms, physical therapy to improve balance, or maneuvers to reposition particles in the inner ear. If you've enjoyed this video and helped you learn more about vertigo, please be sure to subscribe to our channel and click the notification bell so that each week we release a brand new, life-saving video, you'll get notified right away.